Chapter 9. The Washington Health Trust and Global Health Care Comparison. One card, one cure. Healthcare reform in the United States is often framed as a leap into the unknown. Opponents warn of untested ideas, foreign systems, and radical disruption. But when Washington State's Health Trust proposal, Senate Bill 5233, is examined alongside high-performing health systems around the world, a very different picture emerges. The core truth is simple. The Washington Health Trust is not radical. It is familiar. It reflects what already works, internationally, and in many respects, domestically. The real outlier is not Senate Bill 5233. The outlier is the current United States system. To understand why, we must look at the global baseline. What high-performing health systems actually share. Physician and policy scholar Ezekiel J. Emanuel compares health systems in the United Kingdom, Germany, France, the Netherlands, Switzerland, and Canada. Despite differences in culture and financing, these systems share common design features. Universal coverage that is automatic and continuous. Coverage independent of employment. Regulated prices for hospitals, clinicians, and prescription drugs. Administrative simplicity. Strong primary care. Protection from medical bankruptcy. Just as important is what these systems do not do. They do not rely on employers to decide who gets care. They do not allow wildly different prices for the same service. They do not tolerate large-scale uninsurance. They do not deny care. They organize care. The Washington Health Trust fits squarely within this global norm. Senate Bill 5233 does not invent a new ideology. It combines public oversight with private delivery, preserves patient choice, and prioritizes stability during transition. The goal is not disruption. The goal is reliability. Successful reform happens in phases, not suddenly, and not chaotically. Senate Bill 5233 follows this proven path. Phase 1. Stability first. Most residents experience little visible change. They keep their doctors and hospitals. Coverage continues uninterrupted. Behind the scenes, the Health Trust builds the infrastructure needed for long-term success. Phase 2. Simplification and standardization. Plan variations narrow. Benefits are standardized. Rules become clearer and easier to understand. Fragmentation is reduced. Confusion gives way to clarity. Phase 3. One card. Job-independent coverage. Coverage becomes portable and permanent. It no longer depends on employment, income changes, or life transitions. This is where one card becomes real. Phase 4. Full implementation and cost control. Comprehensive benefits are in place. Out-of-pocket costs are minimized. Administrative friction fades. Costs are controlled using proven tools. Global hospital budgets. Transparent all-payer rate setting. Negotiated prescription drug prices. These mechanisms are used today in Germany, France, and the Netherlands. What do patients gain? Security, simplicity, financial protection. No one fears losing coverage. No one faces financial ruin because they got sick. Clinicians gain something equally important: less billing, less administrative conflict, more time for patient care. Lower burnout is not accidental. It is a design outcome. When viewed in global context, the Washington Health Trust is not a leap into the unknown. Universal coverage, price regulation, administrative simplicity, phased implementation. These are proven ideas. As Ezekiel Emanuel concludes, the barrier to reform is not evidence, expertise, or feasibility. It is political will. Washington already knows what works. Senate Bill 5233 shows how to build it, carefully, responsibly, and with people at the center.